Mesothelioma is a type of cancer that is directly linked to asbestos exposure. It develops from the mesothelium, which is a protective lining that covers most of the body's internal organs, the lungs, the heart, and the abdomen. This rare form of cancer has been associated with asbestos exposure in many countries and is often fatal. However, awareness of mesothelioma remains quite low in China compared to other areas of the world heavily impacted by asbestos. Several strategic measures need to be undertaken in order to increase awareness of this deadly disease among the Chinese public and medical community. The first critical step is a nationwide public health education campaign. A large-scale public awareness initiative needs to be launched through various media such as television, radio, newspaper, online, and billboards. Public service announcements need to be run frequently to educate people about what mesothelioma is, its causes and risks, symptoms to watch out for, and the importance of early detection and treatment. High-risk groups such as workers in the asbestos industry, mines, construction sites, shipyards etc. must be specifically targeted. Public town hall meetings, workshops, and community outreach programs led by experts can help create awareness at the grassroots level. Educational brochures, posters and other printed material containing information about mesothelioma should be widely circulated and made easily accessible to the public. The second important measure is physician education. Most doctors currently lack proper knowledge and understanding about mesothelioma due to its unfamiliarity in China. Education programs for medical practitioners must be established across all major hospitals and healthcare facilities. They must be trained to recognize symptoms, make accurate diagnoses, conduct appropriate testing like biopsies, and manage patient care. Specialized training conferences, seminars and continuing medical education sessions led by international mesothelioma experts can help update the skills and knowledge of Chinese physicians. Collaborations can be formed with leading cancer hospitals abroad to facilitate exchange of information and best practices. Awareness must also be increased among lung specialists, primary care physicians, surgeons and other specialists who are often the first point of contact for patients. Thirdly, establishing mesothelioma treatment facilities and regional centers of excellence is urgently needed. Currently, adequate resources and expertise are lacking within the Chinese healthcare system to properly diagnose and treat mesothelioma patients. Designated mesothelioma clinics and departments must be set up in major cancer hospitals, especially those located in industrial regions with high asbestos exposure. They should be equipped with trained staff, advanced diagnostic technologies like PET scans, multidisciplinary treatment services, access to chemotherapy, radiation and immunotherapy, palliative care specialists and clinical trials. Regional centers of excellence can centralize patient referrals, promote early detection, conduct research and data collection, track epidemiology, and help develop Chinese treatment guidelines. Collaborations with global experts will support building high-quality mesothelioma programs. The fourth measure involves strengthening policy in legislation regarding asbestos. China has been slow to implement bans and still permits asbestos imports and use. Comprehensive asbestos policies and laws similar to other developed nations need to be formulated and enforced quickly. An outright ban on asbestos mining, import, export and usage must be put in place. Strict safety and emission standards are required for existing asbestos operations. Workers' rights and compensation laws should be expanded to cover asbestos-related diseases. Policies incentivizing substitution of asbestos with alternative materials in construction should be prioritized. Enhanced governmental funding, inspections and punitive penalties for violations will help strengthen policy implementation on the ground. Fifthly, mesothelioma surveillance programs must be developed. Currently there is limited data available on the true incidence, prevalence, mortality rates, demographic characteristics and geographical distribution of mesothelioma in China. Active surveillance systems involving mandatory reporting of all mesothelioma cases by hospitals need to be instituted. National registries and databases compiling comprehensive clinical information, pathological reports, environmental and occupational risk factor details, treatment outcomes, etc. should be created. Longitudinal epidemiological studies analyzing regional trends over time can yield valuable insights. Surveillance data can then guide effective prevention initiatives, early detection drives in high-risk areas, resource allocation and evaluation of control measures. Lastly, increasing research is paramount. China lags significantly compared to Western nations in terms of mesothelioma research funding and output. Robust research funding mechanisms from both government and philanthropic sources must be established. Multi-center clinical studies, laboratory experiments, translational and genomic research investigating new drug targets, immunotherapies, biomarkers and prognostic indicators should be strongly encouraged and supported. Collaborative international research networks must be fostered. Findings need to be published widely in Chinese and international medical literature to advance the global understanding of this complex disease. Ultimately, research holds the key to developing more effective mesothelioma screening, diagnostic and treatment modalities critical for improving patient outcomes and quality of life in China. A multi-pronged, sustained and coordinated effort encompassing widespread public and physician education, infrastructural development, strengthening of policies and legislation, implementation of surveillance programs, and boosting research is essential to raise awareness and prioritize addressing the impending mesothelioma epidemic in China. International collaborations provide an invaluable opportunity to incorporate global best practices and experiences. With determined action across these strategic areas, mesothelioma can potentially be transformed from an unknown disease to one that is better detected, treated and prevented from causing further loss of lives.